if you are unemployed, the moment you sign up, automatically you can access a level 1, a level 2, a level 3 hospital without payment. The capitation that is going to the hospitals, the facility improvement fund. You know, I was so embarrassed, Honorable Speaker, over the weekend when I had a member of parliament pretending Kikuyu that this chief or shifo and saying it is not this shifo. Shifo is a name for a chief. A member of parliament saying that they do not know the difference between chief and shifo. Yet, you are seated in this house, you legislated right from the first reading to the third reading to the committee of the whole house. You are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between chief and shifo. That you do not know the difference between sha and chief. Honorable Speaker, I am saying I was so embarrassed because I would expect a leader elected by the people believing that that leader knows more than them, to be using that opportunity, Honorable Speaker, to educate their people, to tell them that if you have need to access renal care and dialysis at your dispensary or at your local level 4 hospital, all you need to do if you are unemployed is to do the mean testing score. You are advised how much premium you should pay. When you pay, Honorable Speaker, and I know these are the cries that Kenyans have raised, that the mean testing score is asking you to pay for the annual premiums for the whole year. That was the case under NHIF. You could not access renal care, cancer treatment, without paying your annual premiums, Honorable Speaker. And Kenyans were paying. Today, Honorable Speaker, because SHA, or the Social Health Authority, is yet to activate the insurance premium financing, they have now opened it up to Kenyans to be able to pay every month. Let us educate our people that you now can pay monthly, access your dialysis, access your cancer treatment. Let Kenyans know that today under SHIF or under the Social Health Insurance Fund, they can access dialysis, they can access chemotherapy, radiotherapy, free of charge if they are registered with this authority, if they have paid their premiums. Doesn't matter whether it's annual premiums. If you have access to insurance premium financing to pay your annual premiums, pay. If you cannot, discuss with them and pay your monthly premiums. Access those services. Honorable Speaker, my last point. Our county governments and our county governors, and I really want to plead with our county governor.
A minute only.
In a minute, Honorable Speaker, if our CEC's healthcare in our counties can take up the challenge, because other than the Kenyan public who are the major beneficiaries of this shift, Honorable Speaker, is our county governments. The facility improvement fund that we legislated in this house, I know many politicians will not tell Kenyans that truth, that facility improvement facility empowers your local dispensary to have a committee that will even procure equipment and medicine at that local level. It is the number of people who are registered in that locality and who are registered to that facility that will enable the facility in your locality to access the facility improvement fund that will ensure that a hospital in Gatuna in Kikuyu, the far-flung corner of my constituency, the most remote part of my constituency, if they have a dispensary, Honorable Speaker, they will be able to access the facility improvement fund, be able to equip their dispensary, have medicine available at the dispensary, have money to hire doctors, and we legislated. We made it possible in this House, Honorable Speaker.
Thank you, Majority Leader. The Minority Leader will take precedence over you. Honorable Andrew Kwome, the Minority Leader will take precedence over you, the Minority Whip, for the avoidance. The Minority Whip.
Thank you, Mr. Speaker. And I want to thank Honorable Lilian Gogo.
Honorable Millie will always speak before you whenever she wants.
Though that is discriminatory because the tallest man should be speaking before. But Mr. Speaker, having said that, I want to thank Honorable Lilian Gogo Honorable Dr. Lilian Gogo for bringing this before the House. And Mr. Speaker, I just want to say that under Article 43 of our Constitution, it provides for the right to health to the highest sustainable standard of healthcare, including reproductive healthcare. And legal framework, a new legal framework that replaces NHIF, and we passed 4 bills. And Mr. Speaker, I was in the House when those bills were being passed. I was especially opposed to certain parts of that bill, but that is now water under the bridge. We have a new legal framework. Mr. Speaker, having listened even to the members, the honorable members as they move, Honorable Kimani Ichungwa and even the Honorable Nyikalan, the Chair of Health Committee, one of the things that I can indeed say is that the proof of the pudding is in the eating. We would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later. However, we can see photos of people who are in hospitals who are struggling to access health care. Those with renal issues, those who are cancer patients. And Mr. Speaker, even though I know Honorable Ichungwa is actually castigating a lot of the members who he says are pushing propaganda, he's saying one. I don't know who that is, since I'm not too sure about, I'm not very keen on the politics of the mountain. But Mr. Speaker, what I want to say is that we need to acknowledge that there are very serious transition issues over this. Over this. And Mr. Speaker, if we lose a life, we can never regain it. I have a person who is very close to me who is undergoing cancer treatment right now and will not receive any treatment unless there's pre-authorization of payment. And Mr. Speaker, if me, I'm at the place where I am, maybe because they are able to do that, because we, for different factors we can. But the cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there's a huge problem with the transition. And this transition was not done efficiently. What I would want to encourage the chairman of the Committee of Health is, one, please do a kamkunji for members of parliament. I am a lawyer and I was here when this was passed. And a lot of us would want to sit here and pretend that we understand and know. Me, there are a lot of things I don't understand about this, and I passed this law here. What about ordinary Kenyans? Do an urgent kamkunji for members of parliament so they understand what this new system is all about. Number 2, we need to actually stop most of the things we are doing in this country so that members of the public understand and know how they can access health care. Because health care should be the most primary, right for everybody. Because if I'm already dead, how are you helping me? How will it be of benefit to me if I'm already dead? Even if you are to compensate, I will already be dead. So really, I think we need to take this issue more seriously than we are. Let us listen to the cries of Kenyans. If the health system is not working, a lot of the poor people can't access healthcare system, there is a problem. And Honorable Majority Leader, please listen. Please, the transition is not working well. Please take this and inform whoever needs to be informed that they need to take urgent action. The transition is not working well. Thank you, Lillian, for bringing this.